There are over 600,000 patients undergoing hip or knee surgery every year. About 2% of patients experience serious complications after surgery. Blood clots are among the worst complications because blood clots in the lungs are one of the major causes of post-surgical death. Surgery causes blood to make more clots so that those clots can fix the broken vessels. This heightened tendency to form blood clots is a major concern during and after surgery. The more your body moves, the more your blood flows, and the higher blood flow decreases the danger of forming blood clots. So, with increased blood flow, the sticky little blood parts are not just sitting around getting clumpy. They're moving. But in surgery, there's little movement because for the most part your body just lays there and blood clots can form. When blood clots clump together, they can form into a large clot somewhere in the body. The danger is when these large clots form in the legs, they can break free and travel up to the lungs. And this is the most dangerous part, because a clot in the lungs can block oxygen exchange, which can lead to respiratory failure, which is one of the most serious complications. The good news is surgery-related blood clots are largely preventable. Providers give anti-clotting medication which can be quite effective in helping you prevent blood clots. Additionally, there are mechanical devices that are also used to help move blood through your legs, and this increases blood movement, which helps prevent clots from forming. Despite excellent pre-surgical, intrasurgical, and post-surgical medical treatment, blood clots can still happen. Studies show the incidence of blood clots in the legs can be as high as 33.8% after total knee replacement, and 16.7% after total hip replacement. The jaw-dropping statistic, though, is that 50% of patients with blood clots in the legs end up with a blood clot in the lungs. Good anticoagulation medications and leg compression devices are some of the things your provider can help you with to decrease the risk, but even with the best medical support, clots can still occur. So it's important you understand that there are preventive measures you can take to decrease your risk. First, a solid partnership between you and your surgical team can make it easier for you to achieve the optimal outcome of your safe recovery. Make sure you follow all instructions given to you by your provider with exactness. Be sure to ask questions if there is anything you do not understand. Second, understand that a major risk for blood clots is slow-moving blood. Remember, if you aren't moving, your blood isn't moving much either. And it's when you're not moving your blood can clump up. Laying still during and after surgery causes blood to move more slowly. That's why we use leg compression devices to increase your blood movement, so please use them as much as possible while in the hospital. Walking after surgery gets your blood moving even better. Just ask your provider how much walking you can do. Other devices are available that can stimulate leg muscles to keep blood moving before and after surgery. A device called a neuromuscular stimulator (NMES) is still being researched for clinical use, and these portable devices have electrodes that can stimulate your leg muscles even while traveling to keep your blood moving. Again, the increased blood flow decreases the formation of large clots. Remember, one of the most important things after surgery is to keep moving. Stretch and get up out of your bed. Move often. But also remember to be gentle and know your limitations. Always continue being an active participant in your recovery. Serious references, more references, way more references. If you've made it this far, thank you for watching. I wish you all the best with your recovery. This video was created by PA student Aaron Tjomsland as his graduate project for Drexel University's Physician Assistant Program class of 2019. In loving memory of Hahnemann University Hospital, Gary A., 3rd floor random room, Trusty 4th floor, and Pat. This video is for educational purposes only and not meant as medical advice. Please consult a doctor or your PA first.